បាទជំរាបសួរទូរទស្សនិកជនជាទីមេត្រីបាទសូមស្វាគមន៍មកកាន់កម្មវិធីជួបជាមួយនឹងខ្មែរ TV នាសប្តាហ៍នេះបាទថ្ងៃនេះយើងមានសេចក្តីសោមនស្សរីករាយយ៉ាងខ្លាំងដែលបានជួបជាមួយនឹងដុកទ័រម្នាក់មកពី The Children Clinic នៅទីក្រុង Long Beach ហើយគាត់នឹងឆ្លើយសំណួររបស់យើងអំពីរឿងមេរោគ COVID ដែលភាគច្រើនប្រជាជនខ្មែរយើងទាំងអស់រួមចំណែកទាំងខ្ញុំផងដែរដែលនឹងមានសំណួរទៅដល់គាត់ពីរឿងមេរោគ COVID ពីរឿងមេរោគផ្សេងទៀតដែលវាចេញពីបំបែកចេញពី COVID មកបាទហើយថ្ងៃនេះយើងមានសេចក្តីសំណររីករាយយ៉ាងខ្លាំងដែលគាត់បានមកចូលរួមធ្វើកម្មវិធីនេះជាមួយនឹងខ្ញុំបាទហើយដូច្នេះសូមបង្បាយអារម្មណ៍មកជួបជាមួយនឹងបងឆាលសុងហើយនឹងដុកទ័រមកពី The Children Clinic Family Health ជំរាបសួរដុកទ័រជំរាបសួរបងឆាលសុខសប្បាយ
ជំរាបសួរ
Thank you. At least you can speak Khmer, so I don't have to speak English, right?
Not too much, but Akun.
I'm going to ask in Khmer, and he's going to translate to English so that way you can understand. ថ្ងៃនេះខ្ញុំចង់សួរថាមេរោគ COVID ហ្នឹងមុនដំបូងគេហៅថាមេរោគ COVID ទី19ហ្នឹងបាទមុនដំបូងដល់ពេលឥឡូវហ្នឹងវាបែកចេញមកពី Alpha Beta Gamma ឥឡូវនេះមកដល់ Delta ហើយមានតែមួយទៀតតាមក្រោយក៏ប៉ុន្តែខ្លាំងជាងគេបង្អស់ដែលតាមដែលខ្ញុំដឹងហ្នឹងគឺថា Delta ហ្នឹងវាឆ្លងខ្លាំងហើយខ្ញុំចង់ដឹងថាថ្នាំដែលយើងបានចាក់ការពារហ្នឹងថ្នាំវ៉ាក់សាំងដែលយើងបានចាក់ការពារហ្នឹងពីមុនមក2ដងហ្នឹងតើវាមានប្រសិទ្ធភាពយ៉ាងណាចំពោះមេរោគ Delta ហ្នឹងមេរោគកែមក Delta ហ្នឹងអ្នកចាក់ម្ដងមានប្រសិទ្ធភាពយ៉ាងណាអ្នកចាក់2ដងមានប្រសិទ្ធភាពយ៉ាងណាបាទសូមបងជួយសួរទៅដុកទ័រខ្ញុំផងបាទ
With many viruses develop variants, and so this is not surprising to those of us in the health field that there are variants that are occurring. Like the flu every year, influenza is a little bit different. The predominant variant and the predominant form of COVID-19 or coronavirus right now is the Delta variant. That is the majority. It is more contagious and more easily spread among people. But the vaccine is very effective against
តាមពិតទៅវីរុសទាំងអស់គឺវាស្ថិតតែជាអាចបង្កើតឲ្យមានគេហៅថាជំងឺអ្វីផ្សេងទៅទៀតហើយជំងឺទាំងឡាយនោះដែលវាអាចធ្វើឲ្យយើងតែងតែធ្លាប់ឆ្លងកាត់មកហើយដូចជាជំងឺ flu ជំងឺអីចឹងដែរក៏ប៉ុន្តែDelta variant ដែលគេឲ្យឈ្មោះថាដែលគេឲ្យឈ្មោះថាវីរុសខ្លាញ់បន្លំឥឡូវនេះគឺវាកំពុងតែរីកត្បាតខ្លាំងនៅក្នុងសហគមន៍ក៏ដូចជាទីក្រុងនានាបាទ
So we know that it is more easily spread and that if you are vaccinated, you are protected against serious hospitalizations and even death. So about 90% of the deaths are in the unvaccinated. And
យើងដឹងហើយថាអាការៈរោគនោះគឺអាចឆ្លងងាយស្រួលជាទីបំផុតហើយចំពោះជំងឺថ្មីដែលថាតែជំងឺខ្លាញ់បន្លំ Delta variant ហ្នឹងក៏អាចឆ្លងហើយមានចំនួនទៅដល់ 90% ដែលនឹងអាចឆ្លងហើយការឆ្លងនេះគឺអាចកើតមានឡើងចំពោះបងប្អូនដែលមិនដែលបានចាក់វ៉ាក់សាំងការពារខ្លួន
And these hospitalization and deaths are occurring in all ages and causing a lowered number of intensive care unit beds in the hospitals. In many states, it is at a crisis. So again, it is important to be vaccinated.
ចំនួនមនុស្សដែលបានចូលទៅគេងពេទ្យក៏ដូចជាទទួលនឹងការស្លាប់ដោយសារតែ COVID ក៏ដូចជា variant នេះគឺជាចំនួនច្រើននៅក្នុងនៅក្នុងពេទ្យនីមួយៗហើយជាពិសេសនៅក្នុងរដ្ឋនានាផ្សេងទៀត
And again, so some people who have gotten vaccinated will get the Delta variant, but it will be a much milder case than those who have been vaccinated. And they will most likely not go into the hospital and not die.
សូមបញ្ជាក់ផងដែរថាមនុស្សម្នាទាំងឡាយដែលបានទទួលការចាក់ថ្នាំហើយរួមនឹងអ្នកដែលមិនទាន់បានចាក់ថ្នាំអ្នកដែលមិនទាន់បានចាក់ថ្នាំគឺតែងទទួលរងគ្រោះរហូតទៅដល់មានការគ្រោះថ្នាក់ទៅដល់ការស្លាប់ក៏មានដែរ
That's it.
Okay. What about ចុះចំពោះអ្នកដែលបានចាក់ថ្នាំតែម្ដងឧទាហរណ៍ថា Pfizer ចាក់2ដង Moderna ចាក់2ដងចុះបើសិនជាចាក់តែម្ដងតើប្រសិទ្ធភាពមានដល់កម្រិតណាដែរ
What about folks who get vaccinated what's the difference between the 2-shot Moderna and Pfizer and the Johnson is only get 1 shot? What's the difference between the three?
Well, there are two different types of vaccines. The Moderna and Pfizer are mRNA, and the Johnson & Johnson is a little bit different type of vaccine. They all are turning out to be very protective. The Moderna and Pfizer had a higher rate of people being resistant to disease than Johnson & Johnson, but the Johnson & Johnson is a 1 dose, which makes it easier for some people. And believe it or not, some people are afraid of needles.
នៅក្នុងថ្នាំទាំងពីរនេះគឺថ្នាំទាំងពីរគឺមួយចំ Moderna ហើយនិង Pfizer មកថ្នាំទាំងពីរនេះគឺមានប្រសិទ្ធភាពគ្រាន់បើខ្លាំងចំនួនប្រហែលជា 90% តទល់នឹងជាមួយនឹងថ្នាំវ៉ាក់សាំងដែលមានឈ្មោះថា Johnson & Johnson ហើយដល់ឡែកគឺថាមនុស្សមួយចំនួនគឺថាបើមានការចាក់វ៉ាក់សាំងនេះក៏ដោយសារតែការភ័យខ្លាចនឹងមកចូលចាក់ថ្នាំតែម្ដងបាទ
Well, I'm gonna rephrase my question. What is the effectiveness of single shot Pfizer and single shot Moderna with the Delta variant?
We have not, they're all of 3 of the vaccines seem to be working very well. I've not seen the studies where they break them out individually yet. And
I'm sorry, let me rephrase my question. What I mean is that, Pfizer, you are required to have 2 shots, the first and the second, and Moderna is the first and the second shot. So let's say that one person, they go in, they get 1 shot, and then they did not attending their second shot. Basically, so they do only half instead of a full. You understand what I mean?
So it is recommended for the Moderna and the Pfizer that you complete your 2-shot series. That is much safer. And you're not considered fully vaccinated unless you've had those 2 shots.
តាមការផ្ដល់អនុសាសន៍របស់នៃពីអង្គការសុខភាពបាលគឺថាគឺគេចង់ណែនាំឲ្យប្រជាពលរដ្ឋគឺថាចាក់វ៉ាក់សាំងនោះឲ្យបាន2មជ្ឈលបាទតាក់2មជ្ឈលគឺថាត្រូវតែទទួលចាក់វ៉ាក់សាំងទាំងពីរហ្នឹងបើស្នាទៅលើខាងផ្នែក Moderna ក៏ដូចជា Pfizer.
So I completely understand that it's a requirement. What happened is let's say somebody just get 1 shot and say, oh, you know what, I don't want to do it again, and done. So they only get 1, like half. It happened. We know it happened. So what is the effectiveness of 1 shot against Delta?
Well, I don't have the exact data, but we don't consider anyone fully immunized until they get their 2 shots of the Moderna or the Pfizer vaccine. So anybody who's only gotten 1, we can arrange for them to get another one. Just contact us or the health department or go to CVS.
អ្វីត្បិតតែខ្ញុំអត់មានទិន្នន័យនៅមុខខ្ញុំក៏ប៉ុន្តែខ្ញុំសង្ឃឹមថាបងប្អូនទាំងអស់គ្នានឹងគេថាចាក់ឲ្យតាមអនុសាសន៍របស់យើងនឹងគេតែណែនាំឲ្យយើងនឹងបានចាក់គេថាមជ្ឈលទាំងពីរបើអ្នកណាដែលចាក់មជ្ឈលតែមួយហើយមិនទាន់បានមកចាក់មជ្ឈលមួយទៀតហ្នឹងយើងណែនាំអ្នកទាំងនោះហ្នឹងគេថាត្រូវតែចាក់ឲ្យបានគ្រប់មជ្ឈលបាទ
So what happened if I have COVID right now as we speak? but it's like a small symptom. It doesn't show us much sign. Can I still go and get vaccinated?
ចុះmay I សំណួរសួរថាតើបើខ្ញុំមាន COVID-19 ឥឡូវហ្នឹងហើយក៏ខ្ញុំមានប្រតិកម្មអីបន្តិចបន្តួចទេតើខ្ញុំអាចទៅទទួលការចាក់វ៉ាក់សាំងនឹងបានទេ
The most important thing, if you have COVID symptoms, even if they are mild, is to stay indoors, isolate yourself, make sure you're eating well, drinking fluids, and if you get worse, you call your physician right away. That's the most important. You can get vaccinated after your symptoms are gone. The recommendation has varied for how long to wait, but now they're saying we can do it much sooner than before. So it's important to really take care of yourself.
សារៈសំខាន់គឺយើងត្រូវតែចេះថែរក្សាថែទាំខ្លួនដោយឡែកគឺថាយើងត្រូវនៅផ្ទះដោយឡែកពីគេដែលភាសាខ្មែរហៅថាចាត់តាល័យស័កក្នុងរយៈពេល14ថ្ងៃទៅតាមគម្រោងទៅតាមកំណត់ហើយបន្ទាប់ពីនោះមកគឺយើងអាចទទួលទៅរកការចាក់វ៉ាក់សាំងនោះបានគឺពឹងផ្អែកទៅលើទោះបីជាមានប្រតិកម្មនឹងខ្លាំងឬក៏មិនខ្លាំងក៏ដោយគឺយើងត្រូវដាច់ខាតត្រូវចេះថែទាំខ្លួនឯងមុន
Yeah, and make sure to be away from other people if you can, and make sure others in your house are tested to make sure they're not infected. That's very important. Then we'll get you vaccinated.
ហើយត្រូវចងចាំថាយើងត្រូវនៅឲ្យឆ្ងាយពីគេហើយត្រូវចងចាំមួយទៀតថាក្រុមគ្រួសាររបស់យើងដែលនៅក្នុងផ្ទះហ្នឹងត្រូវតែទៅធ្វើតេស្តដើម្បីឲ្យយើងដឹងថាតើខ្លួនយើងនឹងមានអាការៈរោគនេះក៏អត់បើមានក៏យើងត្រូវតែធ្វើការចាក់វ៉ាក់សាំងទៀត
Okay, thank you, Doctor. We're going to take a quick break, and when we come back, we're going to have a whole list of questions more for you. Okay, ពីកម្មវិធីសូមសម្រាប់មួយផ្លែសិនបាទសូមស្វាគមន៍ត្រឡប់មកវិញបាទ The other question is that how safe is the vaccine?
សំណួរមួយទៀតហ្នឹងដល់ឡែកគឺខ្ញុំចង់ដឹងថាតើវាការចាក់វ៉ាក់សាំងហ្នឹងវាអាចមានប្រសិទ្ធភាពយ៉ាងម៉េចដែរឬក៏វាមានគេហៅថាភាសាអង់គ្លេសថា safe នឹងយ៉ាងម៉េចដែរបាទ
Yes, this is one of the most studied vaccine ever, certainly in my whole career. There have been hundreds of millions of doses given worldwide.
បើតាមការសិក្សាគឺការសិក្សាគឺថាឡើងលំអិតជាទីបំផុតការវ៉ាក់សាំងនេះហើយគឺការចាក់វ៉ាក់សាំងនេះគឺទូទាំងពិភពលោកតែម្ដង
The Pfizer recently got the FDA approval. It's now no longer under emergency use, and it underwent a very vigorous review. I am very comfortable with these vaccines.
Pfizer ទៅតែនឹងបានអនុម័តដែលហៅថាយល់ព្រមពីអង្គការមហូបអាហារក៏ដូចជាអង្គការមហូបអាហារអង្គការមហូបអាហារហើយនឹងឆ្នាំហ្នឹងគឺថាបានផ្ដល់នៅការអនុម័តយល់ព្រមទៅលើការនេះហើយគឺ Pfizer នេះគឺបានឆ្លងកាត់នៅការធ្វើតេស្តហើយតេស្តទៀតដែលមានការកំណត់យ៉ាងច្បាស់លាស់
They also were developed with years of research behind them and the techniques for this vaccine development.
ហើយគេអាចស្រាវជ្រាវនៅក្នុងការស្រាវជ្រាវហើយក៏ការលំអិតនៅក្នុងការតេស្តនេះទៅធ្វើដើម្បីនឹងជាច្រើនឆ្នាំដល់មុននៅពេលដែលគេអាចយកមកប្រើប្រាស់នោះបាន
Thank you. The other question is that in Cambodian term, or I mean, a lot of the time I do that. A lot of the people say we call the vaccine or the medicine. Usually, it's a sword with two edges, so it's cut both sides. Another word, and these vaccines right here. What is the side effect? What is the edge that cut? What is the side effect to our body after we get vaccinated?
So there are very minimal side effects. I mean, serious side effects are extremely rare, but everybody will get probably a sore arm, okay, a little bit of pain, and maybe some redness and swelling in the site where they got the vaccine, about here, okay? And then you may get tired, have headaches, some muscle aches, some chills and fever, and maybe a little nausea. But it only lasts for 48 hours. It's gone in 48 hours. And to me, it is showing that your body is mounting the response that we want to this really serious, serious disease.
តាមពិតទៅការដែលប៉ះពាល់ទៅដល់នៅសុខភាពហ្នឹងគឺវាមានគេថាភាពតិចតួចជាទីបំផុតដូចជាការឈឺចុកចាប់ប្រហែលជាមានស្លាកស្នាមក្រហមនៅនឹងដៃឬក៏ហើមដៃបន្តិចតួចហើយនឹងប្រការមួយដែលគេថាពាក់ព័ន្ធទៅនឹងធ្វើឲ្យយើងនឿយហត់ឈឺក្បាលឬក៏ឈឺកន្លះដៃស្លាក់ជើងសាច់ដុំឬក៏គ្រុនឬក៏អីចឹងទៅក៏ប៉ុន្តែកត្តាទាំងនេះគឺយើងត្រូវចងចាំថាកត្តាជាចាំបាច់នៅពេលដែលអាការៈរោគនោះវាអាចដូចថាគ្រឿងដែលវ៉ាក់សាំងហ្នឹងដែលវាអាចបញ្ចេញទៅក្នុងខ្លួនធ្វើឲ្យយើងមានប្រតិកម្មដូចជាជួយកម្លាំងនៅក្នុងផ្លូវខ្លួនប្រាណរបស់យើង
Thank you. So the other question would be, does it cost to get vaccinated?
No, it is either free or they bill your insurance.
គឺការចាក់វ៉ាក់សាំងនេះគឺអត់មានគិតថ្លៃអីទេចំណុចមួយគឺថាវាអាចដោយអត់គិតថ្លៃចំណុចទី2គឺគេថាគេឆាចគេទៅលើនឹងអាសរងរបស់យើង
Thank you. The other thing is that a lot of the time I meet with the younger, healthy, fitness, very fit kids, and they say, hey, you know, I'm fit, I'm healthy, I eat healthy food, I exercise every day. Why should I get vaccinated? I'm not going to get COVID. Can they be unvaccinated? What they're thinking?
Well, what they're seeing is that now that the elderly people have all been vaccinated, it's the young and the healthier people that are getting sick. And some of them are getting very sick now, not at the same rates as the very elderly and the chronically ill, but some are getting sick, they're being hospitalized, and they're even dying. I have friends, I'm a pediatrician, I have friends all over the country. I have friends working in Florida. Their ICUs are being filled with children, and children are dying. We are seeing, there are young women that are pregnant that have died. There are their babies that have died. So it's really important to protect themselves, but also it is about loving and caring for your community and those that live in your community that may not be as strong as you, that may not have as healthy diets as you, that may not be able to get vaccinated. And it's about trying to protect not only yourself, which is very important, but to care and protect your community. And that will stop the spread of this.
សំណួរបានសួរថាតើបើខ្ញុំនៅក្មេងវ័យខ្ញុំមានកម្លាំងបលាំងរឹងមាំតើខ្ញុំគួរតែចាក់វ៉ាក់សាំងដែរអត់ទេគាត់ក៏ឆ្លើយថាយោងទៅតាមដែលអ្វីដែលបានឃើញហ្នឹងគឺថាចំនួនច្រើនគឺថាឥឡូវហ្នឹងចំនួនកើនកាន់តែច្រើនគឺថានៅលើក្មេងៗហ្នឹងហើយដែលទទួលការរងគ្រោះដោយសារការមិនចាក់វ៉ាក់សាំងនោះយ៉ាងណាមិញគឺថារួមសេចក្តីសង្ខេបមកគឺថាឲ្យខ្លីដោយឡែកគឺថាយើងត្រូវតែចេះធ្វើម៉េចដើម្បីការពារយកចិត្តទុកដាក់ពីព្រោះនេះមិនមែនស្ថិតទៅលើការចាក់វ៉ាក់សាំងឬក៏អ្វីដែលយើងនឹងគ្រាន់តែថាស្រឡាញ់ទៅខ្លួនប្រាណរបស់យើងគឺយើងអាចទៅដល់ទៅការស្រឡាញ់ទៅដល់សហគមន៍របស់យើងក្រុមគ្រួសាររបស់យើងអ្នកជិតខាងរបស់យើងដើម្បីបន្តដំណើរជីវិតទៅមុខទៀត
For the people who has a chronic illness, for example, young or old, regardless of the age, when they have diabetes, high blood pressures, and cholesterols, and all of those stuff, is it safe for them to get vaccinated?
Yes, it's usually safe, and it's really important because they're the ones that are getting the sickest. It can be life-saving for them. So if you have a chronic disease, it is very important to get vaccinated. If you're concerned, you may speak with your physician. I was speaking to some of my staff that treat adults and work with the Cambodian community. And they said what they want you to do is come and see them and ask your questions, and we will review it with you and make sure you understand that it is safe in almost all cases. So they will review that with you.
សំណួរបានសួរថាតើបើសិនណាខ្ញុំមានជំងឺរ៉ាំរ៉ៃនៅក្នុងខ្លួនតើខ្ញុំអាចមានសវត្ថភាពទេនៅក្នុងការចាក់វ៉ាក់សាំងចម្លើយគឺបានឆ្លើយបាទវិជ្ជបណ្ឌិតបានឆ្លើយថាពិតណាស់គឺសំខាន់ជាទីបំផុតគឺថាយើងមានសវត្ថភាពជាទីបំផុតជាពិសេសគឺចំពោះបងប្អូនដែលមានអាការៈរោគរ៉ាំរ៉ៃនៅក្នុងខ្លួនដាច់ខាតត្រូវតែចាក់វ៉ាក់សាំងត្រូវចាក់វ៉ាក់សាំងពីព្រោះបើយើងអាចធ្វើការចាក់វ៉ាក់សាំងវាអាចកាត់បន្ថយនៅគ្រោះថ្នាក់របស់យើងដូច្នេះបងប្អូនអាចចូលទៅសួរនាំឬក៏អាចទៅធ្វើជាសំណួរបាននៅតាមរយៈគេហៅថាមន្ទីរពេទ្យដែលនឹងអាចឆ្លើយនៅសំណួរទាំងនេះបាន
And we want our patients to ask us questions because we are all comfortable with the vaccine and we want the patient to be comfortable too. We don't want to force you to get the vaccine. We want you to understand how important it is.
ដូច្នេះមុនពេលលោកអ្នកដែលចង់ប្រការណាដែលលោកអ្នកមានជំងឺរ៉ាំរ៉ៃនៅក្នុងខ្លួនមុនពេលលោកអ្នកមានចង់បានមានកំណត់ថាចង់ចាក់វ៉ាក់សាំងយើងខ្ញុំគេថាសុំឲ្យបងប្អូនមានសំណួរនៃចម្ងល់ដោយសារតែយើងចង់ឲ្យលោកអ្នកចាក់វ៉ាក់សាំងនេះទៅតាមចំណង់ចំណូលចិត្តរបស់លោកអ្នកដោយមិនមានបង្ខិតបង្ខំអ្វីទេ
The other question I'm going to ask this first, but the next one is probably going to be a little bit more different. The woman who has pregnant with the baby either from the first month, the second month, or up the way all to 8-9 months, is it safe for her to be vaccinated?
Yes, we are now recommending, and the Centers for Disease Control and ACOG, which is the professional group for obstetricians and gynecologists, have both agreed that it is very important for pregnant women and women who are planning on getting pregnant to be vaccinated. Go ahead, Charles. សំណួរសួរថាតើការចាក់វ៉ាក់សាំងចំពោះអ្នកស្ត្រីដែលមានផ្ទៃពោះហ្នឹងតើគេមានសុវត្ថិភាពដែរឬអត់ចំពោះអ្នកហ្នឹងចម្លើយគឺថាត្រឹមត្រូវពិតប្រាកដជាមានសុវត្ថិភាពតាមរយៈដែលវិជ្ជបណ្ឌិតខាងរោគស្ត្រីក៏ដូចជាវិជ្ជបណ្ឌិតខាងផ្នែកខាងបង្កើតទារកបានឲ្យដឹងថាការដែលសម្រាប់បងស្រីដែលមានផ្ទៃពោះហ្នឹងគឺថាគឺការចាក់វ៉ាក់សាំងនេះគឺជាការល្អហើយមានសុវត្ថិភាពសម្រាប់យើងទាំងអស់គ្នា And we now know because they've been following cases that there's a higher risk of fetal or the baby inside death and or the mother from coronavirus if you are pregnant. And that is why we are encouraging vaccination.
ឥឡូវយើងក៏បានដឹងហើយថែមទៅទៀតថាអាការៈរោគនេះបានបណ្ដាលឲ្យកូនដែលនៅក្នុងផ្ទៃពោះនឹងអាចទទួលរងគ្រោះក៏ដូចជាម្ដាយដែលអាចទទួលរងគ្រោះទៅដល់ជីវិតដូច្នេះទើបយើងសូមណែនាំហើយណែនាំទៀតដើម្បីជំរុញធ្វើយ៉ាងណាឲ្យមេដាដែលជាអ្នកដែលមានផ្ទៃពោះនឹងមេត្តាទៅចាក់វ៉ាក់សាំង
Thank you. We're going to take another quick break, and when we come back, we're going to have lots more questions for you, Doctor. Please come with me some reflection. បាទសូមស្វាគមន៍ត្រឡប់មកវិញបាទ The next question would be if I get vaccinated, will I be able to fly freely, or do they still need to get that vaccination card when you go onto the airline?
Yeah, I think it varies the travel. Oh, I'm sorry. Translate. Sorry, Charles.
សំណួរបានសួរថាចុះបើខ្ញុំចាក់វ៉ាក់សាំងមិនចាក់វ៉ាក់សាំងដំណើរដើរហើរទៅក្រៅប្រទេសឬក៏ទៅតាមយន្តហោះយន្តអីហ្នឹងតើមានចាំបាច់ត្រូវការខ្ញុំត្រូវអាចហោះហើរទៅក្រៅបានអីដែរឬទេបាទ
So I think the ability to fly is much easier if you're vaccinated. There's no question. And it varies by country and by state. Some people, they want you vaccinated and they want you tested. So I think if you want to travel a lot, it's highly recommended to be vaccinated because it's only going to get stricter probably. So just to be safe when you're in other states or countries, I would recommend getting vaccinated, even if it's not required. But the other thing is, you could end up getting very sick in another country. And, we have a very good medical system here. It is not perfect, but it is a very strong medical care system here, but not everywhere is like that in the world. So I think it is the safest to be vaccinated, and it is a lot easier to travel if you are vaccinated.
ខ្ញុំយល់ឃើញថាការចាក់វ៉ាក់សាំងនេះតាមពិតទៅវាមិនមានជាការកំណត់ថាតើយើងត្រូវដើម្បីទៅដើរហើរទៅប្រទេសផ្សេងគិតតែយ៉ាងណាមិញក៏ប៉ុន្តែបើយើងឲ្យគិតថាចំនួនខ្លួនរបស់យើងនឹងដើម្បីឲ្យមានសុវត្ថិភាពរបស់យើងនឹងយើងគួរតែចាក់វ៉ាក់សាំងដើម្បីជៀសវាងក្រែងលោដល់ពេលណាមួយយើងអាចមានគ្រោះថ្នាក់នៅទទួលពេលណាដែលយើងទៅលេងនៅក្នុងប្រទេសណាមួយដូច្នេះការចាក់វ៉ាក់សាំងជាការល្អដើម្បីឲ្យយើងនឹងមានសុវត្ថិភាពនៅក្នុងការដើរហើរ
Thank you. The other question would be, if I get vaccinated, I still get COVID. And if I don't, I still get COVID. So why should I get vaccinated if I'm going to get both of them anyway? Either one.
I've said this before. So what you're talking about, if you're vaccinated and you get COVID, that is what's called a breakthrough infection. And what we know is people that have been vaccinated, if they get COVID through breakthrough infection, which is not uncommon, because no vaccine is expected to protect everybody. But what it does do is protect you against serious illness, hospitalization, and death. So that is the reason you're getting vaccinated, for the hospitalization and the death. But the breakthrough cases are much lower in number than they first anticipated. So it does protect you from getting COVID, but there will be breakthrough cases. And I'm sure we probably all know someone who has gotten breakthrough cases. Sometimes they were immunocompromised and probably didn't mount as good of a response to the vaccine. So now they're actually recommending a third vaccine for the Pfizer and the Moderna for people who are immunocompromised or have illnesses where their immune system is not as active and does not respond as well.
Yes. Yes. សំដួរសួរថាចុះបើខ្ញុំមិនចាក់ក៏ឆ្លងចាក់ក៏នៅតែឆ្លងតើខ្ញុំចាក់នៅវ៉ាក់សាំងនេះចាក់នឹងមានបានកាយដែរចម្លើយសួរថាដូចខ្ញុំបានជំរាបដើមឡើយគឺថាការចាក់វ៉ាក់សាំងនេះទោះបីតែយើងយ៉ាងណាក៏ដោយតែយើងត្រូវតែការពារខ្លួនគ្រាន់តែនៅក្នុងចំណុចមួយអ្នកដែលចាក់ហើយគឺយើងអាចការពារខ្លួនរបស់យើងនៅក្នុងការឆ្លងនេះគឺគេការឆ្លងនៅក្នុងវគ្គគេហៅថាអ្វីដែលហៅថាគេហៅថាในការឆ្លងកាត់នៅវីរុសនៅក្នុងខ្លួនប្រាណរបស់យើងនេះជាពិសេសគឺថាប្រព័ន្ធសាំដែលចំពោះប្រជាពលរដ្ឋមួយចំនួនដែលពាក់ព័ន្ធទៅនឹងក្នុងខ្លួនប្រាណសភាពការរបស់គាត់ដែលមានប្រព័ន្ធសាំលំបាកនៃការពារហ្នឹងវាតែងតែអាចមានអញ្ចឹងហើយបានគេថាឲ្យយើងចេះតែនាំគ្នាទៅចាក់វ៉ាក់សាំងដើម្បីកាត់បន្ថយនៅអ្វីដែលហៅថាភាពធ្ងន់ធ្ងរនៃការចាក់វ៉ាក់សាំង
Do you want to add to the answer, Doctor? What is the percentage of the hospitalization for the people who get vaccinated, and then percentage of the people who are not get vaccinated?
Yeah, and the death rate. It's about 90% of the people, and they don't have the exact numbers yet. They didn't start collecting it. They're still trying to get the hospitals to give them the data. So this is the estimate, but it's very clear that the majority of the people, vast majority, have not been vaccinated, and the ones that are dying have not been vaccinated. If they have been vaccinated, usually there's someone who has some underlying condition or illness.
តាមខ្ញុំយល់គឺថាគ្មានទិន្នន័យណាឲ្យបានច្បាស់លាស់ទេតែខ្ញុំគឺអាចយល់ឃើញថាប្រហែលជាចំនួន 90% ដែលពាក់ព័ន្ធទៅនឹងការទទួលហ្នឹងដូច្នេះគឺថាអ្វីដែលហៅថាបានទទួលហ្នឹងគឺថាវាស្ថិតនៅលើការដែលចំពោះដែលអ្នកដែលពុំទាន់ដែលបានចាក់វ៉ាក់សាំងហ្នឹងគឺចំនួនវាអាចច្រើនជាងចំនួនមនុស្សដែលគេចាក់វ៉ាក់សាំងហើយ
It's about what the estimate is about 90% or higher of people that are in the hospital or dying have not been vaccinated, but we don't have the exact numbers.
បាទចំនួនមនុស្សដែលបានទទួលគ្រោះថ្នាក់ដល់ការស្លាប់ហ្នឹងគឺអាចមានចំនួនច្រើនក៏ប៉ុន្តែនៅក្នុងបច្ចុប្បន្ននេះយើងអត់ទាន់មានចំនួនទិន្នន័យណាឲ្យបានពិតប្រាកដដើម្បីបញ្ជាក់បានទេ
In those states that have the highest rates with Delta virus now, they're the states with the lowest vaccination rates.
ហើយចំពោះនៅក្នុងរដ្ឋមួយចំនួនដែលកំពុងតែមានការ Delta variant ដែលកំពុងតែរាតត្បាតហ្នឹងគឺមានចំនួនខ្លាំងគឺថានៅក្នុងរដ្ឋទាំងអស់នោះហើយដែលកំពុងតែទទួលការរងគ្រោះធ្ងន់
So the people who are unvaccinated has the higher death rate and higher hospitalization than the people who vaccinated, basically.
ដូច្នេះចំនួនមនុស្សដែលមិនចាក់ថ្នាំហ្នឹងដែលត្រូវទៅចូលពេទ្យឬក៏ទទួលការរងគ្រោះដោយស្លាប់ដោយ Delta variant ហ្នឹងគឺមានចំនួនលើសលប់បាត់ច្រើន
Hospitalizations and those deaths could have been prevented, the majority of them.
ដូច្នេះការដែលទៅចូលគេងពេទ្យក៏ដូចជាការគ្រោះថ្នាក់ទៅដល់ជីវិតហ្នឹងគឺអាចសិតតែអាចការពារបានទាំងអស់ចំពោះមនុស្សមួយចំនួនធំបាទ
Yes, you're absolutely right because that's as you can see, Florida has run out of hospital bed and even run out of nurse. Don't even have nurse.
And everyone is very tired, and it's very hard because we know that something could be done, and it's hard.
យើងបានដឹងហើយថាការឆ្លងកាត់ទាំងអស់នេះអ្នកដែលធ្វើការនៅជួរមុខគឺកាយទទួលការលំបាកហើយគឺថាភាពលំបាកនៃការបង្ខំឬក៏ជំរុញណែនាំឲ្យមនុស្សទៅការចាក់វ៉ាក់សាំងនេះគឺកាន់តែមានភាពលំបាកជាងនឹងទៅទៀត
So the next question is what should I do as a family member in the household if one of the family member has a COVID-19?
Well, you should as best. Oh, I'm sorry, Charles.
សំណួរបានសួរថាតើខ្ញុំត្រូវធ្វើយ៉ាងម៉េចដែរប្រសិនណាបើសមាជិកណាមួយនៅក្នុងគ្រួសារមាន COVID-19
So I think the most important thing, if you can, isolate them. You know, if you can't, everybody needs to wear masks in the house. But ideally, isolate them, give them their own bathroom to use, leave them food, make sure they're all right, call your doctor if they're positive. But everybody else should continue to quarantine themselves. They shouldn't be around any other people. If you've already been exposed, you should stay and not be out in public. You need to wear masks, good masks, and you need to get tested after it's about like 2 to 4 days to get tested. If you've been vaccinated, you should still mask and get tested just to be sure. But if you're vaccinated, you don't have to be in for 14 days and do all the quarantining. You can, if you have a negative test, go back to work if you need to. So there are different ways. It depends on the situation, and you need to clear it with your workplace and with your doctor. But please don't go out and not wear masks and social distance when you can and isolate.
ក្នុងករណីនេះចំណុចសំខាន់បំផុតនោះគឺយើងត្រូវតែនៅដោយឡែកពីគេពីឯងហើយដាច់ខាតគឺយើងត្រូវពាក់ម៉ាស់ បាទត្រូវពាក់ម៉ាស់ចំពោះណាបងប្អូនណាដែលបានចាក់វ៉ាក់សាំងហើយមានក្នុងករណីនេះកើតមានឡើងបន្ទាប់ពី2ឬក៏3ថ្ងៃបងប្អូនអាចទៅឆែកមើលហើយអាចទៅត្រួតពិនិត្យមើលហើយមិនមានជាការចាំបាច់អីទេបងប្អូនអាចបាទធ្វើរបាយការណ៍វិលត្រឡប់ទៅធ្វើការងារវិញបានក៏ប៉ុន្តែគឺថាសូមជំរាបទៅដល់បងប្អូនដែលនៅក្នុងផ្ទះដែលមានក្នុងករណីនេះដែលកើតមានឡើងនោះគឺថាដាច់ខាតទី1គឺថាត្រូវនៅដោយឡែកម្ហូបអាហារអីគឺថាត្រូវញ៉ាំឲ្យដាច់ដោយឡែកពីគេក្នុងបន្ទប់ដោយឡែកពីគេហើយដាច់ខាតគឺត្រូវការពាក់ម៉ាស់ការពារខ្លួន
How effective is mask against COVID-19?
I think it's very important to wear a mask. It is effective, but it has to be it has to be a mask that is tight fitting with a metal so you can pinch it around your nose, okay? And it has to be worn properly. I mean, you know, you've all seen people walking around with their mask below their nose. I just want to walk up to them and fix it. But so it is important. The best protection is vaccinating. But if you're, you know, now with Delta variant and breakthrough, you know, it is recommended wearing masks indoor and outdoor if you're close together. And that is really important. And we know it does make a difference. When we loosen things and the Christmas and we had that huge surge, you know, it really was out of control until we started vaccinating and masking more. And then we kind of let our guard down and then Delta variant came and then it went up again. And so the vaccination is number one, but the masking is number two and the washing your hands. But it is okay, so too much talking. Sorry, Cheryl.
តែការពាក់ម៉ាស់មានប្រសិទ្ធភាពយ៉ាងណាដែរបាទការពាក់ម៉ាស់គឺមានប្រសិទ្ធភាពណាស់ជាពិសេសគឺថាចាំបាច់ត្រូវពាក់ម៉ាស់ណាដែលជាម៉ាស់ហ្នឹងគេហៅថាម៉ាស់ដែលត្រឹមត្រូវអ្នកបងប្អូនខ្លះហ្នឹងគឺគាត់ពាក់ម៉ាស់ដែរក៏ប៉ុន្តែគាត់អត់បានពាក់ទៅឲ្យបានត្រឹមត្រូវទេគាត់ពាក់នៅក្រោមច្រមុះអីចឹងទៅអញ្ចឹងគឺថាការពាក់ម៉ាស់ហ្នឹងគឺត្រូវម៉ាស់ហ្នឹងត្រូវតែមានដូចថាយើងដឹងហើយម៉ាស់ខ្លះតើមានដែកហើយដែលវាខ្នាស់ខ្ទាស់នៅលើច្រមុះរបស់យើងពាក់ទៅតឹងដើម្បីនឹងការពារខ្លួនរបស់យើងណាដោយគាត់កំពុងតែពាក់ឲ្យយើងមើលឃើញអញ្ចឹងបានលបងឲ្យយើងមើលបានឃើញអញ្ចឹងគឺថារបៀបពាក់ម៉ាស់ហ្នឹងគឺថាតលតែអញ្ចឹងហើយម៉ាស់ហ្នឹងល្អធ្វើម៉េចឲ្យវាតឹងកុំឲ្យវានេះអីអញ្ចឹងទៅហើយដាច់ខាតហ្នឹងគឺថានេះក៏ប៉ុន្តែសារៈសំខាន់ហ្នឹងគឺថាទី1ត្រូវតែចាក់វ៉ាក់សាំងបាទចាក់វ៉ាក់សាំងហើយទី2ត្រូវតែពាក់ម៉ាស់ទោះបីជានៅខាងក្នុងផ្ទះក្តីគឺនៅខាងក្រៅផ្ទះក្តីគឺថាគួរតែអនុវត្តទៅតាមនោះ
If you are outside and you're apart from each other and it's, you know, you're not close, then it's okay not to wear your mask. But if you are indoors and not in your own office, like, you know, we are now, you need to wear your mask, even if you've both been vaccinated.
ប្រសិនបើយើងនៅទីក្រៅបាទក្រៅលំនៅឋានយើងនៅឆ្ងាយដោយឡែកពីគ្នាយើងមិនចាំបាច់ពាក់ម៉ាស់អីក៏បានដែរផ្ទុយទៅវិញប្រសិនណាបើយើងនៅក្នុងបន្ទប់ដែលមានមនុស្សម្នានៅក្នុងហ្នឹងគឺថាដាច់ខាតយើងត្រូវពាក់ម៉ាស់
Thank you, Doctor. For me, I think that we are fighting the invisible enemy. And every step before I take a step out of my door, my mask is on. Automatically N95 because I think that if I die, I don't come back tomorrow. It's not coming back. Once you're gone. And protecting your health is the number one priority, that's regardless of what. Because money cannot buy health. And that's what I think. And that's what I do. Because even doesn't matter where I go, even I get vaccinated already, I still do that. Anyway, we're going to take another quick break, and when we come back, we're going to have the final segment and have a lot more questions for the doctor. But ពីកម្មវិធីសូមសម្រាប់មួយផ្លែសិនបាទពីកម្មវិធីសូមត្រឡប់មកវិញបាទ The next question would be for the lady who have a newborn, breastfeeding. Does the vaccination have any effect to the mother milk or to the baby?
Well, it is okay to breastfeed if you've had the vaccination. And it may probably, you may have the antibodies in that milk that are passed on to the baby. So those first 6 weeks, those first early weeks are very important for babies, and they do get a lot of the immunological antibodies in that milk. So it is fine to breastfeed.
ខ្ញុំយល់ឃើញថាសំណួរគឺជាសួរថាតើខ្ញុំចំពោះស្ត្រីដែលមានកូនខ្ចីតើយើងអាច breast ណាឲ្យកូនបើកដោះហ្នឹងតើវាអាចមានប៉ះពាល់ឬក៏មានអ្វីទៅក្នុងខ្លួនដែរទេចម្លើយគឺថាដូចជាមិនអីទេចំពោះណាស្ត្រីភេទពីព្រោះនៅក្នុងសពានកាយរបស់យើងតែងតែមានគេហៅថាអង្គបដិបត្តិដែលជួយទប់ទល់ក៏ដូចជានៅក្នុងទឹកដោះគោដែលយើងឲ្យដែលទឹកដោះគោរបស់ម្ដាយហ្នឹងគឺតែងតែមានដែលអង្គបដិបត្តិដែលគេហៅថាអង្គតៃ body ហ្នឹងគេអាចជួយទ្រាំទ្ររបស់យើងដូច្នេះគឺដូចជាមិនអីទេបាទ
So the other question is that if I'm isolated, basically, let's say that I work in my own office, I'm not communicate with anybody other than on the phone, stay most of the time, stay home. Can I not get vaccinated?
Charles?
សំណួរបានសួរថាចុះបើខ្ញុំនៅតែឯកោតែខ្លួនឯងនៅក្នុងបន្ទប់នៅក្នុងផ្ទះខ្ញុំមិនចេញទៅណាទៅអីហ្នឹងតើខ្ញុំមិនចាំបាច់វ៉ាក់សាំងហ្នឹងបានដែរអត់ទេ
I think it's very hard to be totally isolated in this world. I don't think man was meant to live alone. Social isolation is very bad for your health. Go ahead, Charles.
ភាពឯកោបើតាមខ្ញុំយល់ដឹងគឺថាមនុស្សទូទៅជាពិសេសគឺថាសម្រាប់តែបរិសុទ្ធហ្នឹងគឺខ្ញុំអត់ជឿជាក់ថាយើងអាចនៅឯកោទៅខ្លួនឯងទេនៅជាពិសេសគឺថានៅក្នុងពិភពលោកទាំងមូលហ្នឹងគឺថាអញ្ចឹងដូចថាខ្ញុំយល់ឃើញថាភាពឯកោហ្នឹងមិនវាអាចអ្វីដែលចាំបាច់តែយើងនេះទៅបានទេ
So I think the beauty of the Cambodian culture and the culture that I was raised in is that communal interacting with family and friends. And that is very good for your health. It's very good for Alzheimer's prevention. It's very good for longevity. As is getting out in nature and seeing beauty and going to the beach and going to the mountains and to the parks and things. So I think, yes, I guess you could isolate yourself, but I don't think it would be good for your health when we have solutions like vaccines that can help you be able to go out more.
ខ្ញុំយល់ឃើញថាភាពឯកោគឺវាអាចធ្វើឲ្យយើងនឹងកាន់តែមានការទទួលរងគ្រោះដូច្នេះในការភាពណាយើងអាចនាំគ្នាចេញទៅក្រៅបើតាមតែវប្បធម៌របស់ខ្មែរយើងក៏ដូចជាការរស់នៅរបស់ខ្ញុំនឹងការដែលយើងចេញទៅក្រៅយើងឃើញគេឃើញឯងគឺអាចនាំមកផលល្អច្រើនសម្រាប់យើងទាំងអស់គ្នាដូច្នេះខ្ញុំអត់មានការណែនាំឲ្យយើងនៅក្នុងគេហៅថាភាពឯកោតែខ្លួនឯងនោះទេ
Thank you. I think the question is probably trying to find an excuse to avoid get vaccination. Probably that's what the question is meant to be. Because
get people to get vaccinated. Yeah, I think yes.
Yeah, because I'm pretty sure that no one can live alone in this planet. You have to be with somebody, work with somebody somehow, because that's how we all are. We all, they call social animal or social human.
Yes, I think, when you look at all the different places in the world where people live a long time, there are certain things that come up over and over again. They call them the blue zones. And it is that community interacting with different ages, different people, eating well, exercising. Those are all things that require being outside and interacting with people.
ពិភពលោកយើងនៅខាងក្រៅហ្នឹងគឺថាមានប្រទេសខ្លះដែលនៅស្ថិតនៅក្នុងគេថាគេថាតំបន់ពណ៌ខៀវហ្នឹងថាគេរស់រានមានជីវិតរបស់គេហ្នឹងមានភាពប្រសិទ្ធភាពល្អរបស់គេដោយសារតែគេតែងតែចេញទៅក្រៅឃើញគេឃើញឯងចឹង
The other question is you were mentioned earlier about the booster shot. How is the booster shot distributed right now? Is it the same like before, where more chronic people get first, older people get first, or how does it work?
What's happening now, right now, is that we're giving a third shot. It's not called a booster, to people that are immunocompromised. And that started like a month ago. Okay. That's not a booster shot. There was discussion and an announcement about booster shots starting, I believe, September 20th. And it was 8 months after your first vaccine. 8 months after you finished your second vaccine, if you got the 2 vaccine. The ACIP, which is the National Immunization Advisory Group, is meeting today to determine whether they're going to recommend that. It was announced, but then they started looking at the data more closely. So sometimes I think we want to make sure we have the data before we start trying to give the boosters to everyone. So that's what they're reviewing now. So I don't know if it's going to start September 20th.
booster shot ពាក្យទៅថា booster shot ហ្នឹងគឺថាការចាក់ថ្នាំបង្ការរោគបងដែលបងប្អូនខ្មែរយើងច្រើនតែនិយាយថានៅចូលទី3អីចឹងតែទៅតាមការដែលប្រកាសផ្សាយហ្នឹងគឺតាមពិតទៅនៅខែ9ថ្ងៃទី20នេះក៏ប៉ុន្តែកិច្ចការនោះគឺបានបង្អាក់ទៅវិញដោយសារតែគេមិនទាន់បានបញ្ជាក់ច្បាស់លាស់ទេក៏យ៉ាងណាមិញគឺមានចាក់ថ្នាំសម្រាប់ទៅដល់បងប្អូនបាទទៅដល់បងប្អូនដែលមានគេហៅថានៅក្នុងខ្លួនដែលមានប្រព័ន្ធសាំលំបាកការពារនោះគឺថាគឺគេចាក់ទៅឲ្យបងប្អូនចំពោះអ្នកទាំងនោះហើយនឹងចំនួនចំពោះទៅដល់បងប្អូនដែលមានអាការៈរោគនៅក្នុងខ្លួនក៏ប៉ុន្តែគេមិនមែនហៅថាការចាក់វ៉ាក់សាំងនឹងbooster shot ឬក៏ថ្នាំបង្ការរោគដែលបញ្ចូលទី3នោះទេ
Doctor, well, thank you very much for spending time with us today. One last question. If I or all our audience out there or anyone out there that still have question about COVID, where can they find out about the information about that?
I would encourage them to talk to their physician. They don't have a regular physician. TCC Family Health is here to serve the community, so Charles knows how to find us. There's also, I believe, a question and answer line at the health department. They can ask questions. I would recommend really talking to a healthcare professional that they trust. As I said, that's very helpful to many of our patients. I talked to Jenny Cree. She's our nurse practitioner. She's from the Khmer community in Long Beach. And she said it makes a huge difference for many of her patients for them to come in and even in person and talk to her about what their worries are and their concerns. We also, many doctors, and we are doing telephonic visits. Some people are doing televideo visits where they can ask questions. Because we want people to understand how safe it is and to feel comfortable. And I know there's a lot of misinformation that we would like to correct. So
សំណួរបានសួរថាចុះបើប្រជាពលរដ្ឋចង់បានអំពីព័ត៌មានបន្ថែមអំពីការចាក់វ៉ាក់សាំងតើគេត្រូវទៅទទួលយកនៅទីកន្លែងណាបាទចម្លើយបានឆ្លើយថាគឺថាយើងអាចទី1ពាក់ព័ន្ធទៅនឹងវិជ្ជបណ្ឌិតផ្ទាល់ខ្លួនបាទវិជ្ជបណ្ឌិតផ្ទាល់ខ្លួនរបស់យើងអាចទៅជួបវិជ្ជបណ្ឌិតរបស់យើងសួរនាំឲ្យបានច្បាស់លាស់ហើយគេរងចាំទទួលនឹងឆ្លើយនឹងសំណួររបស់យើងជានិច្ចកាលទី2យើងអាចទៅប្រព័ន្ធគេហៅថាប្រព័ន្ធអ៊ីនធឺណិតតាមរយៈអង្គការhealth department ខាងអង្គការខាងផ្នែកសុខាភិបាលហ្នឹងគេអាចជួយចែកចម្លែកទៅដល់សាច់រឿងហ្នឹងដល់ឡែកគឺថាដូចជាវិជ្ជបណ្ឌិតមួយចំនួនដែលធ្វើការឲ្យខ្ញុំនៅក្នុងអង្គការ TCC ដូចជាខ្លួនខ្ញុំផ្ទាល់អីហ្នឹងគឺថាយើងអាចដើម្បីនឹងមកជួបនឹងវិជ្ជបណ្ឌិតផ្ទាល់វិជ្ជបណ្ឌិតនឹងអាចជួយជម្រាបអំពីកិច្ចការដែលពាក់ព័ន្ធទៅនឹងការចាក់វ៉ាក់សាំងហ្នឹងឲ្យបានក្បោះក្បាយជាទីបំផុត
Yeah, and we're happy through Charles to answer questions also. So we have lots of physicians and nurse practitioners, all of who have been vaccinated, so that is good. Several speak Khmer and are from this community, so they, I think, would be happy to join in this also. So.
ខ្ញុំសូមបញ្ជាក់ផងដែរថាដោយឡែកគឺខ្ញុំបុគ្គលិកនៅ TCC Family Health នឹងស្រាប់ដូច្នេះប្រសិនណាបើពុកម៉ែមានពុកម៉ែមីមីទាំងអស់មានសំណួរឬចម្ងល់កន្លែងណាដែលខ្ញុំអាចនឹងឆ្លើយជូនបានខ្ញុំនឹងព្យាយាមចម្លើយជូនពុកម៉ែមីមីបងប្អូនហើយកន្លែងណាដែលខ្ញុំមិនអាចនឹងឆ្លើយបានខ្ញុំនឹងព្យាយាមស្វែងយល់អំពីវិជ្ជបណ្ឌិតបន្តដើម្បីនឹងជម្រាបជូនទៅដល់ពុកម៉ែមីមីបងប្អូនដើម្បីឲ្យពុកម៉ែមីមីបងប្អូនបានយល់នៅសារៈសំខាន់នៃការចាក់វ៉ាក់សាំង
And their doctors should be willing to talk to them about this. So that's important. So we're here, their doctors are there, their nurse practitioners are there. We just want to make sure the community is safe. It's about not just yourself, it's about your community and keeping everyone safe. The more we're all vaccinated, the safer we'll be.
ថែមពីនេះទៅទៀតខ្ញុំយល់ឃើញថាវិជ្ជបណ្ឌិតនៅក្នុងកលតិស័កនេះគឺសិតតែមានបំណងចង់ចែករំលែកនៅព័ត៌មានដែលពាក់ព័ន្ធទៅនឹង COVID-19 ពីព្រោះការចាក់វ៉ាក់សាំងហើយនឹងអ្វីដែលយើងបានឃើញនេះមិនត្រឹមតែជាការការពារខ្លួនគឺថាវាធំសំខាន់គឺថាទៅលើការសេចក្តីស្រឡាញ់ខ្លួនឯងផ្ទាល់ក៏ដូចជាក្រុមគ្រួសារហើយនឹងក៏ដូចជាសហគមន៍របស់យើងប្រទេសរបស់យើងទូទាំងពិភពលោករបស់យើងបាទ
And I want to thank everyone in the community for getting vaccinated. Many, many people have gotten vaccinated. I just don't want to talk about the ones who haven't. So, kun to all of the people that have gotten vaccinated. And we want the other people to feel comfortable being vaccinated.
ហើយខ្ញុំក៏សូមឆ្លៀតឱកាសនេះផងដែរដើម្បីនឹងថ្លែងអំណរគុណទៅដល់ប្រជាពលរដ្ឋទូទៅនៅក្នុងទីក្រុងជុំវិញទីក្រុងក៏ដោយនឹងដែលបានចាក់វ៉ាក់សាំងរួចហើយដល់ខ្ញុំមិនចង់ផ្ដោតទៅលើអ្នកដែរមិនចង់ចាក់វ៉ាក់សាំងទេយ៉ាងណាមិញគឺសូមថ្លែងអំណរគុណហើយថ្លែងអំណរគុណទៀតទៅដល់ប្រជាពលរដ្ឋដែលបានចាក់វ៉ាក់សាំង
Thank you very much, Doctor, for coming and joining us today. Our program come to the conclusions right now. Do you have any last word that you want to say to our audience or people out there?
Again, thank you. And if you need any more questions answered, I'm here for you. And Charles is here for you. And we are all here for you. So thank you.
ម្ដងទៀតជាចុងក្រោយខ្ញុំសូមឆ្លៀតឱកាសនេះផងដែរដើម្បីថ្លែងអំណរគុណហើយថ្លែងអំណរគុណទៀតហើយបើសិនណាបងប្អូនមានសំណួរនឹងចម្ងល់សូមមេត្តាតាក់ទងមកយើងខ្ញុំដែលមានខ្ញុំបាទនៅបម្រើកិច្ចការនៅនឹង TCC នោះស្រាប់បាទសូមអរគុណ
Thank you very much. Thank you. សូមអរគុណដល់ទូរទស្សនិកជនទាំងអស់ដែលបានតាមដានទស្សនាខ្មែរ TV បាទសូមជូនពរឲ្យទូរទស្សនិកជនជួបប្រទះតែសេចក្តីសុខប្រកបមុខរបររកស៊ីមានបានហើយមានសុខភាពល្អបំផុតគ្រប់ក្រុមគ្រួសារបាទពីយើងខ្ញុំទាំងអស់គ្នាសូមអរគុណនិងសូមជម្រាបលា